Hey guys, in this video we're going to be taking a look at some issues generally regarding autonomy and paternalistic actions and policies. So we're going to look at this idea of autonomy as a capacity. We're going to be looking at medical paternalism and when it might be justified. We'll take a brief look at refusing treatment, futile treatment, and involuntary psychiatric commitment, and how all this sort of ties into respecting autonomy and whether or not paternalism is justified. So autonomy is something that we've come across already in this class. If you recall, the principle of autonomy basically states that we ought to respect people's autonomy. But what autonomy is a capacity. Specifically, it's a capacity for self-governance and self-determination. It involves a power that we have to assess values, to endorse values on the basis of reasons, and to act upon values. It involves the capacity to deliberate about our different options that we can choose from. So when we act autonomously, we act when our choices are truly our own choices. So there are many different examples of autonomous actions. We do them all the time. For example, you can choose different meals to eat. Let's say you choose the healthy meal and you can cite reasons why you chose the healthy meal. That's an autonomous action. But we also take many actions that are not autonomous. Actions that are not autonomous can be involuntary actions, sneezing, walking down the road, maybe kicking a rock, not really thinking about it, things that we do maybe without really thinking about it, but also things that we do if we are coerced or forced. Those are also not autonomous actions. And again, the principle of autonomy is very important in bioethics, and it states that autonomous people should be allowed to exercise their capacity for self-determination. So when we recognize an autonomous person's autonomy, we are essentially respecting them. So respecting people involves recognizing their autonomy. Now, one thing to note that's important is that the principle of autonomy, respecting people's autonomy, only applies to autonomous persons. So people who are not autonomous or have maybe a lower degree of autonomy, this principle may not apply in those cases. An example might be young children have either no autonomy or a very low level of autonomy. So it's okay to, so this principle isn't going to be applicable for them. Now, generally there are some questions regarding when we can limit a person's autonomy, and that's what we're going to be talking about today. So examples of limiting a person's autonomy when it comes to medical ethics would be physical restraint, misinforming the patient or not giving them enough information, coercing the patient. Usually nudging isn't really considered limiting their autonomy, but one thing to keep in mind is that respecting autonomy does involve giving them enough information so that they can make informed, rational choices. So informed consent is important for recognizing autonomy. So paternalism ties into this issue of autonomy. So generally speaking, paternalism is when we override somebody's actions or their decision-making for their own good. So we do something for somebody for their own good. And there are many examples of paternalistic actions, and it's debatable whether or not some of these are justified or not. So one example would be a parent sort of enforcing rules for their kids. These are paternalistic actions, saying that they need to go to bed at this time, and those are generally justified, especially because children don't have autonomy or they have a low degree of autonomy. But more controversial paternalistic policies would be, for example, requiring people to wear a helmet when they ride a motorcycle. So some states require this, some don't. Those that do require this, this would be an example of a paternalistic action saying you have to wear a motorcycle helmet for your own good, whether you want to or not. So that's paternalism. Now, there are different kinds of paternalism, and we will distinguish between weak paternalism and strong paternalism. According to the definitions we're going to use, weak paternalism is paternalistic actions or policies that are directed towards somebody who has little or no autonomy. Now, this is especially important within the medical field in cases of incompetent or incapacitated patients, as we will see. Strong paternalism is more controversial. This is a paternalism that's directed towards somebody who is autonomous. So motorcycle helmet laws would be an example of strong paternalism. So those are the definitions that we are going to use. Now, paternalism, importantly, ties into competence or judgments of whether or not a patient is competent. Now, judging whether a patient is competent or not isn't black and white. So competence versus incompetence sort of comes along a scale. And what constitutes proof of incompetence is up for debate. And often, the physician might make a judgment call regarding this. Now, one thing to consider is that competence, generally speaking, is relative to some activity. So most people are not competent in some area. For example, I'm not competent in astrophysics or pretty much any sport. So there are ways in which I'm incompetent, ways in which you are incompetent. But now the question is, well, what must someone be incompetent at for paternalism to be justified, especially within medicine? So within medicine, we're looking at a kind of general incompetence. We're looking at an incompetence in making prudent decisions that are in one's own interest. And even that, it gets a little bit difficult to judge. In any case, legally, the burden of proof is on those who want to judge somebody incompetent. So when somebody within the medical context sort of goes into a hospital or whatever, competence is presumed and does not have to be proved. So incompetence has to be proved, not competence. So this is kind of like guilty or innocent until proven guilty, competent until proven incompetent. Now there are a few different stances, sort of broad stances on paternalism. We can look at three of them. So the first stance we can just call anti-paternalist. This condones weak paternalism toward people who are not autonomous, but it staunchly rejects strong paternalism. And the value of autonomy is highly prioritized according to the anti-paternalists. So libertarians lean more toward anti-paternalism. Now there's also a view that we could call counterfactual consent paternalists. And this basically says that some actions of paternalism are justified if the person would consent given more ideal circumstances. An example of this would be something like, let's say your roommate is a smoker and he's committed to quitting and he really wants to quit, but he caves, he gives in to his craving, he goes out and buys a pack of cigarettes. Then he goes out and you see the pack of cigarettes on the table and you know that if in ideal circumstances, if he wasn't craving it, he would want you to either hide that pack of cigarettes or throw them away. So you throw them away for his own good because you know that he would want you to do that. So that would be an example of counterfactual consent paternalists. And finally, we have beneficence paternalists. And this is more on the utilitarian side, which basically says that paternalism could only be justified by weighing autonomy against beneficence. So autonomy is important, but also beneficence is. So sometimes paternalistic actions are justified if it really does produce a lot more good. So motorcycle law, helmet laws, for example, could say, going by this view, that it is justified to enact this paternalistic act of requiring motorcycle helmets because it is for that person's own good, but also for the good of that person's family, because not having a motorcycle helmet, if they get into a wreck, it's much more likely they're going to die, and that's going to produce a lot of suffering for their family. And so in the interest of well-being, promoting well-being and beneficence, we should have that law. So that's an example of beneficence paternalists, that way of justification. Okay, so let's talk a little bit about refusing treatment. This ties into respecting autonomy. So there are cases in which respecting a patient's autonomy requires acting in a way that may not be in their best interest. And in some of these cases, we should nevertheless respect that patient's choice. There are many different examples of this. For example, refusing treatment. So is it okay to respect a patient's request to not be treated, even though treatment would be in their best medical interests? And the answer is now yes. Generally, legally now, patients do have the right to refuse treatment. And that was based on many cases that you'll see in your book. So this right of refusing treatment extends to patients when they become incompetent as well. And this is a very interesting issue. So we can respect a patient's autonomy, which may include respecting their right to refuse treatment, even if they are incapacitated or incompetent. And the way we do that is through two ways. One is through an advance directive. So when the patient is competent, they can write out an advance directive and say, for example, if I'm in a coma, do not resuscitate. And that's a way of respecting the patient even when they become incompetent. Another way of respecting a patient's autonomy who's incompetent is through surrogate decision makers. So a surrogate who knows the patient can make choices on behalf of that patient and choose what they believe the patient themselves would choose. And that's a way of respecting that patient's autonomy. Now, the right to refuse treatment becomes much more controversial when parents exercise that right on behalf of their children. For example, there are maybe cases when a child needs a blood transfusion, but the parents, for religious reasons, reject that treatment because it's forbidden by their faith. Now, should this be allowed? Should there be a law that says no, the parents don't have a right to reject treatment on behalf of their children? So this is a controversial issue, and it's definitely something worth thinking about. Now, respecting autonomy also ties into futile treatment. Futile treatment is when a physician deems that any treatment for the patient will not help the patient enough to justify the treatment. The treatment is futile. There are cases in which a patient or a family wants treatment, even when the physician, out of beneficent motives, does not want to perform it because the physician deems the treatment futile. So these cases involve conflict over medical futility, particularly also what constitutes futility. So that's one issue here. And another issue is, if a physician deems treatment futile, should the physician respect the patient's or the patient's family's wishes of continuing treatment? So let's look at that first issue real quick. What constitutes futility? Well, physicians may judge that some treatment is futile if it does not create psychological benefit, so that's one account. But the family may judge that something is futile only if it doesn't keep the body alive. So part of this conflict involves what constitutes futility. Generally, those who argue in favor of the sanctity of human life often clash with the physician's judgment of futile treatment. The classic example is a patient is in a coma. The physician deems treatment futile and so says there's nothing more we can do, but the family wants to continue treatment. They may even want to wait for a miracle to occur or something like this. And generally, from what I've gathered, the physician or the healthcare professional will continue treatment for maybe a small amount of time, maybe a week, to accommodate the family's wishes, but no more than that. And one reason is because in continuing futile treatment, you're withholding scarce medical resources from other people that could use it, who would get better, whose cases are not futile. So this issue also has to do with the topic of scarce resources. Okay, so I'm going to pause here and then we'll continue this on video number 2.